All right, welcome, welcome. It's great to have everyone. My name is Farrell Kuritzis, and I'm the director of the Center for Arts and Medicine at the University of Florida. We are delighted to have you join us for the third webinar in our Arts and Health webinar series, Creativity as Prevention, the Role of the Arts in Public Health. Today, we're exploring how arts and cultural engagement can support public health, shaping well-being, strengthening communities, and contributing to prevention efforts in meaningful ways. To help frame today's conversation, I'd like to introduce the Center's Director of Research Initiatives and longtime leader in the field of arts and public health, Dr. Jill Sankey. Jill, welcome.
Thank you, Farrell. It is so great to be with you all today. I'm just thrilled to see you all here and to see the interest in this topic, which is really, really exciting. I've been hanging out at the intersections of the arts and health for 35 years in healthcare and public health as an artist researcher and now a cultural strategist serving as a U.S. Cultural Policy Fellow. And I have to say that this is absolutely the most exciting time to be in this field. So many people from different disciplines and different institutions have joined this field. And I have to say that in spaces that I'm moving in right now, people are now looking to arts in health as an arts and discipline that has made it, that is really making things happen, and that now sets an example for other cross-sector collaborations, engaging the arts and other disciplines. So you're going to learn so much from these incredible leaders today. We're so proud of our artists and faculty and alumni and staff. And I just wish you all the best in your incredible work. And thank you for the work that you're doing to make this field the thriving and impactful space that it is today. This is the time when we as artists who understand health are needed to imagine healthier futures. And you are all the people to do it. Thank you for being here.
Thank you, Jill. I'm going to share some housekeeping reminders in the chat momentarily because we have a full agenda for you today. But now I'm very pleased to introduce our moderator, Natalie Rella, who will guide today's conversation. Natalie.
Good afternoon, everyone. I'm so delighted to be here to join you all in this, our third webinar in the series, the Arts in Public Health specific webinar. In the past, the first one kind of covered the overview of the field of arts and health, then we narrowed down to the arts and the community or the clinical setting, or hospital setting, and now we're pulling back to the public health space. And public health is near and dear to my heart. I got my MPH from the University of South Florida. Go Bulls and go Gators. But this space for me is very exciting. And when I think about creativity as prevention, I'm talking about like the importance of that upstream strategy, the reducing risk, the strengthening, the conditions that support health before a crisis occurs. And I know that arts and cultural engagement operate in that space. So for example, the center researchers recently, last fall, published a systematic review in Nature that looked at arts and public health interventions and how they significantly increase participation and sustain engagement and change health behaviors. And we also have this great EpiArts lab that studies secondary data sets. It's a National Endowment for the Arts research lab. And what it has shown is consistent links between arts participation and improved health outcomes, from increasing flourishing and reducing substance use in teens to improved cognition and longevity in older adults. So really across the life course. So the arts in public health are not an add-on, right? The arts are not an add-on. It is an essential part of the prevention infrastructure that, as Jill mentioned, is growing in the United States and beyond, to advance well-being, health equity, and long-term behavior change, critical partners in that effort. So today I'm thrilled to hear from practitioners in action who are going to share real-time experiences that they have undertaken in this space of bringing arts-based practices into public health. So hopefully some insights will be garnered for you to take into your work. And I'm going to move into welcoming these incredible panelists. First, we've got Tessa. Tessa Brinza is an artist, facilitator, administrator, and researcher advancing health and well-being through the arts. She is actually a Center for Arts and Medicine alum doing great work and currently holds a dual appointment as a program manager with the Arts Initiative and Wolverine Wellness at the University of Michigan. Within this role, she leads the development of Arts RX, which is a program that expands social prescribing research and programming across campus. Thank you for being with us, Tessa. Next up, the indomitable Shira Curtis. Shira is a dance artist who uses movement-based creative programming to advance community health and well-being. As an artist and medicine practitioner at UF Health Shands Arts and Medicine, she bridges dance engagement and public health through mentorship, community partnership, and culturally responsive programming. She leads Seniors on the Move, which is an incredible program. If you've ever experienced it, you can't sit down, you must move. It's a community-based dance and movement program that promotes physical activity, so much joy, and social connections among older adults, particularly seniors of color. And next up, the never to be forgotten, Sarah Hines. Sarah is a visual artist and community arts facilitator whose work centers on creative engagement as a pathway to health and connection. As an artist at the UF Health Shands Arts and Medicine program, she leads large-scale community projects like the Heart Wall, a mosaic that was created with over 2,500 community members in Gainesville. It was epic. And her practice bridges art, culture, and well-being in both clinical and public health settings. So with that, I'm going to just jump right in. Should we do it? Okay. All right, without further ado. Okay, so this is for everyone to share your experience. I'll let you chime in at will. What are some key ways arts and culture participation support prevention, health promotion, and population well-being? For example, through social connection, stress reduction, behavior change. Anyone want to have a go?
Sure, how about it? Hi, everyone. It's so nice to see you. I really, really appreciate all of those of you who popped into the chat. It's nice to see everyone joining from all over the world and your rich experiences. We have wood carvers and art therapists, and so I'm really enjoying that. I believe firmly that art is a vessel for connection. I think about this vessel metaphor a lot. I'm really into the science fiction writer Ursula Le Guin, who introduced me to this theory. And I think that this metaphor of a vessel offers us the idea of art being the firm walls for self-expression, identity building, connection. I work both in clinical and community settings, and so I'm often used as a tool for distraction, and that's just fine with me to be used as a tool, right? But I'm also invested in creative placemaking and the ways that we can use the arts to make our communities better and foster a sense of civic imagination. And above all, using arts to find flow within ourselves in difficult times and find flow in larger communities. It's proven that this can happen if we actively engage in the arts and also if we passively experience the arts, right? And the last thing I like to think about is this idea of wonder and how wonder can recharge us. I find wonder in nature. I find wonder when people are really kind to each other. And I find wonder through the arts. So a lot of these community engaged projects and arts and public health that I work on, I try to hit all of those at one time, right? And hopefully rejuvenate the people that I'm working with. That's a start.
Thank you, Sarah.
You're welcome.
Shiro, are you up?
Oh, I am up. So, how do I see the arts as prevention? A lot that I see within our community, especially with seniors on the move, I've seen a lot of just rebranding the lived experience. A lot of the participants that I have within Seniors on the Move, they're women that are 63 to 93. They talk about how they didn't want to be grandmas anymore, that are just sitting at home, taking care of children, watching stories. They wanted to be known for something more. And what I found out through just their experience through dance and movement and just our engagement is it has become like a reconnection to life well lived. It's become a reconnection to community and what community and sisterhood means to their community. Well, to their smaller community, their smaller hub. It's more of finding purpose, confidence, resilience, redefining what it means to be an aged individual. We have a lot of ageism that comes within the culture, just in general, especially with trends happening. They kind of get a little obsolete. So I find that redefining themselves within the overall culture has been a beautiful journey for them. So just repurposing themselves, repurposing with resilience and definitely confidence. One thing that one of our participants said recently, we had a performance a couple of weeks ago, was I feel confident when I dance. I don't even worry about if I don't remember a step or anything. You make us feel so reassured about just being present with us that I feel like I can do anything. So that level of confidence and security that they have through the arts is a way to live more intentionally. And I think that's what it kind of brings to the table as well.
I'll just jump in, given that we have a short time today. It's so nice to be here with everyone. A lot of what both Sarah and Shreya have already said, I would agree with. Connection is the biggest thing for me. Connection to yourself. I'm a dancer. That's my background. So connection to your body, but also connection to others. We've been finding with the Arts Rx and social prescribing work on campus that it is this really creating this really lovely reciprocal relationship between arts as well as the healthcare workers. So my role originally started at just the Arts Initiative, and now I'm between the Arts Initiative and Wolverine Wellness. So we are actually bridging the health promotion unit on campus with the arts, and I think it's just that connection. It spreads beyond just the individual, and it really helps to create community on campus. I also think of it as an invitation to engage, an invitation to look beyond, in our campus community, it's academics. So, inviting students and faculty members to actually engage with their community and their surroundings and their own well-being. But I think that that can go beyond our setting and just remind people to take a pause out of their everyday busy lives, engage with art and engage with their well-being. So yeah, that's what I would add.
It's a good segue to the next question, Tessa, because I'd love for you to describe the model where arts programming has integrated into a public health system. And I'm thinking specifically of yours. Can you talk a little bit more about how you are making that happen?
Absolutely. So the ArtsRx program at Michigan launched this past fall in August, and that's a collaborative relationship between Wolverine Wellness, which is our health promotion unit on campus, as well as University Health and Counseling, which includes our counseling and psychological services. So we are also seeing this work happening in both clinical and non-clinical settings, and there's just been tons of momentum on campus around that. In fact, actually, in a couple of weeks, a little preview for you all, we will be launching what is going to be called Experience RX Social Prescribing at Michigan, which will encompass not only the arts, but also nature, service, and volunteerism, as well as shared meals. And so when I talk about that, arts being this vehicle and this driver of a lot of this work, we are now seeing that ripple across campus in a really exciting way. So we'll have an event for staff where we'll have folks from M Dining providing meals. We'll be doing a painting of succulent pots, and then other people are going to be giving the succulents away because we'll be with our arboretum. And so it's just all of these different people that are normally working in silos coming together. I think that the arts have been a really powerful driver in that.
Thank you. Anyone else have a program model to share? I can talk a little bit about the during the pandemic, the Center for Arts and Medicine was invited to help build 2 field guides that talk about how to collaborate with artists and culture bearers in a community to increase vaccine uptake. And the field guides, which we will share links to at some point, helped to lay out a roadmap essentially for people in communities to make programs happen with the public health departments and the artists in their communities. And Atlanta was a really good example of a community that did that well. They had like a series of activations for over at least a year. It was the artists in their communities, like several arts organizations, along with the public health department, and they, got tons of people to participate in an arts activity and get vaccinated. And they evaluated it. It was like a real public health campaign in partnership with arts and culture bearers in the community. And then that kind of expanded also to other places around the country, and we saw real movement happening. It was special. So that's another example that comes to mind.
I'll just chime in quickly. We're a small team of artists working in a really large teaching hospital, so we have to prioritize the patients that we create with. And one population that we've prioritized is folks living with sickle cell anemia. These are folks who are often stigmatized within our healthcare system as being drug seeking and otherwise not given the quality of care that they always feel they deserve. And so we've partnered with patients with sickle cell over the past number of years with Arts and Medicine and another program within our hospital called Streetlight, which offers peer-to-peer support to uplift their voices through the arts. So we did this the first year through a sickle cell quilt project where each panel of the quilt was designed by a patient living with sickle cell. Last year, we did it through an album called The Warrior's Path, where sickle cell patients could write songs, and we had a record launch. And this year, we're doing it through a book of poetry called I Am. And these are art resources that are distributed within our entire healthcare system. So both pediatric and adult providers, social workers, and people across the institution are given access to these resources, and it helps them see their patients in a different light.
All right, thank you. I'm going to move on. Shara, I'm going to put you on the spot. Can you share a community-based example where arts engagement has strengthened resilience or addressed a public health challenge? And I'm thinking, you mentioned Seniors on the Move, which you can talk more about. I love it. But also the Dance for PD work that you do could be another example to share.
So I was like, are we on? So they both are very important programs. Dance for Life is a program specifically for neurological movement disorders, individuals outside. So more that continuum of care. We're not a hospital-based program. We're outside in the community. We do a class on Wednesday online that connects with, we have participants from Germany, California, local Gainesville area, and they have MS to Parkinson's to dystonia. So there's several different diagnoses. And the connection that we make with them is it feels more community based. It feels more like we're lightening the load, making connections that are eliminating that social isolation, that are bringing more resilience within their diagnosis. So they don't necessarily always show up as the illness or the limitation, but the program centers more of that dignity or vitality to give them the strength to be able to make these genuine connections with each other as well as others. If you were able to be a part of these programs, you'll see how the connection kind of is very fluid. There's a lot of conversation. There's a lot of talk about how they feel strengthened through the program. Many of them are dancers previously. So they talk about their experience through their bodies and how it's translated to now. Although they don't show up the same way, they still find like confidence and I think it's just a reframing of really who they are now. And it's still meaningful. It still gives them wellness. They still have this long-term quality of life that they feel they have, and that's important. And then with seniors on the move, it gives that same feel that these are older adults. They live within the community where there's limited access to arts-based programming, and for them, it's not necessarily just about an optional thing. I think arts for that population is more of a lifeline. It creates a sense of wellness that is a necessary tool for developing lifelong wellness. Yeah, I could talk more about it, but I'm just like, I'm feeling like a little fluttery, honestly. Another question?
Beautiful. Yeah, beautiful.
I'm
Well
sorry.
said. No, all good. So, okay, this is for Sarah, but anyone can chime in because this work at the intersection of arts and public health like requires cross kind of like what's it called? Cross sector collaboration. So, Sarah and others, what role does cross sector collaboration play and partnerships play in making these models work or making arts and public health work?
I think it just amplifies what you're able to do, right? You're working within systems that already exist and not reinventing the wheel. So Natalie mentioned the Heart Wall earlier, which was a giant football field long mosaic that I created in this community with funding from One Nation, One Project. And that was all the sectors, y'all. So I first started by listening, and that's something that I feel like we should really focus on a bit in this work in arts and public health, is that it can be tempting to go in with your idea of what the answer is or what the project is, but starting out with just receptive listening is a super important first step. So with the Heart Wall, I started out by listening to our local police department and downloading maps of violent crime that had happened in our area, right? I am not personally, I don't have the scope to address that violence directly, but what I did was when I worked on mosaic workshops all around our community, over 75 workshops, I prioritized workshops that were happening in places where violence was rampant, right? I collaborated with our local utility company. They had an area that they considered a blight, and public art was a way to address this blight. So the location of the wall is in an area right next to our biggest city park that was considered blighted, right? I worked with arts administrators within the arts and medicine team, raised them up, right? And arts teachers all throughout our community. So, in addition to the students being able to create mosaics that were then put into a larger project, art teachers were also lifted up through the project itself. And then also the city of Gainesville. So, if you're an artist listening to this call, what that practically means is that I sent about 500 emails before I ever touched the first mosaic tile, and just know that that time is valuable and it's time well spent.
I would just,
Beautiful. Yeah.
oh, I would just jump in to echo that. I talk a lot about exactly that, Sarah, making sure that there is like the prep work is the work, making the relationships is the work. So much of when I first got to the University of Michigan, and I've lived in Michigan for most of my life, but this was a whole new ecosystem that we had to start to not only help share about what arts and health is, but also learn what are the existing systems here that we can tap into? What are the things that they're looking for? And so it's been such a gift to be able to work with wellness coaches who are in Wolverine Wellness, with counselors who are at CAPS, because they have all kinds of ideas of how the arts could be applied. And so I think it's really important to go in and move at the speed of trust versus coming in as an artist, like all of these ideas that we might have. And instead of just trying to like implement those right off the ground, which can be tempting, it can be so tempting, especially when there are like funding, requirements and deadlines. But to actually make the relationship building be a key part of your programming and be open to learning from these other units and sectors.
I learned this key term from Jill Sonke. It's called trustworthiness. Building those relationships with diligence and concern and authenticity and being consistent. Those are very important, like characteristics and traits that you should have whenever you're building with a community-based organization. And I think that's what's important that I can highlight all through what Sarah and Tessa have said is trustworthiness and just being consistent throughout the process, not wanting to just have pilot programs that come in and come out, but how can you sustain those relationships outside of pilot programs and these one-offs.
And so that's a great segue to the next question. What challenges have y'all faced? And, sectors come with their own set of cultural standards and values. So how do you bridge? How have you found, what challenges have you found, and how have you found bridge or overcoming those challenges?
I think as I've developed in this work, I've just recognized more how much administrative support is needed or how much of my time needs to be devoted to administration of a project, and also recognizing that if a project's going to feel authentic to the community, then it's not necessarily the fastest way to work. Right? And just having peace with that. So I again shout out all of the folks who help coordinate these projects and all of the organized behind the scenes efforts.
Barriers that have existed with creating collaboration. I echo with Sarah. It is not going to be a quick process at times, especially when you're coming in and you're trying to get indoctrinated with what the needs are. There's a lot of listening. There's a lot of sharing information or not sharing the information that you want to share. It's just more so listening what their needs are and how can you deliver what they need opposed to what you think they need in a community. And I think giving them exactly what they're asking for within the pathway that yields the biggest return. I think that's our strength as practitioners is creating that arts and health wellness or creating those comprehensive programs that are going to eliminate social isolation or build community or bring resilience. But how can we be very intentional about using our skill set and our skills to really introduce arts in a way that is going to be culturally in tune to that population. So being strategic with that is very important as well.
I think something that I've learned too is that what can help move that process along is just really clear communication about what your goals are within the arts programming, and making sure that there's flexibility for alignment with your partners and for the wants and desires of the community to come forward. But I'm thinking of, so for instance, we did a survey last winter before I officially came on with UHC, University Health and Counseling, and the Arts Initiative about arts and loneliness. And I think it was something like 64% of students responded that they'd be more likely to attend an arts event if their therapist or clinician recommended it. And 73% said that they'd be more likely to attend an event if they knew that there'd be somebody else to go with them. So that was like a clear barrier for students, that they didn't have a friend or acquaintance to go with. So we launched art meetups this past fall, where it's an organized meetup, and then they go to different things around campus. It might be an artisan market, it might be a free concert. And in my mind, that's very clear. You go, you meet up, you talk, and then you go. But for our CAPS counselors, they're like, but what are they going to be doing at this? And so actually taking a moment to break down, because I think that that's like something that people who love the arts, engage in the arts, we're like, yeah, the arts are great for us. They make you feel good. But being able to articulate what it is you're really trying to do, because it is a skill set, as Shira was saying, and we shouldn't shy away from that. We should actually do the work of communicating that to our partners as well as audiences.
And I would add to that, thank you all, great feedback. Typically, there you would find a champion. You can find a champion in that other organization, that other institution that believes in the arts and maybe has some decision-making power, or at least some relationships with people with decision-making power. And you make a relationship with them, and you scheme together, and you know get something small going, and then it can grow. The other thing to, I think it was Noor had a good question, that it can be challenging because public health folks rely on data, right? Like evaluation is mission critical for funding to happen or to be believed, to make sure, right? You have to have evidence to support that what this action that you're taking is going to have some impact. So, in my experience, it is findings like that is the partnership. You maybe the artist doesn't have those skill sets, but the public health practitioner does. And so you understand where your collective powers can come together to make the dream happen. And also, there's a lot of evidence now that supports it. So when you're writing a grant, there you can cite many articles now that would support a grant application. And I'm going to share all of those with you if you don't already know about them. But that, the ROI is starting to be established in the evidence base. But there aren't as many demonstration projects as we need or would like. But they exist and they've been evaluated. And so it can also be just like finding the evidence to support your project, that it would work, because it can work. It does work. That's what we know. Okay. Any other
I'll just
barriers?
pipe on really quickly
Go
that
ahead.
what Tessa said. I mean, I'm much more likely to go salsa dancing after work if I have a buddy, right? And I think recognizing the bravery that it takes to get out there these days and show up to some of these events, as a practitioner, giving the moment to verbally recognize someone's bravery and showing up is part of your work as a creative facilitator, right? Part of your work is creating positive, safe space for people to express themselves, and recognizing walking in the door as the biggest barrier is important.
I just want to remind folks to put your questions in the Q&A so that I don't miss them in the chat. There are trainings and grant writing tips and ways to articulate and sell a project, but that's not one of the questions on this long list of questions, but I can answer it in a future moment. Okay, so let's talk about engaging and applying this idea of arts and public health. For anyone who wants to chime in, for someone that's new to arts and public health, what practical first step might they take in their own community? And maybe you're coming in from the artist perspective, maybe you're coming in from the public health perspective. What's a practical, concrete first step, if you can share one? Or two or three.
I was going to jump in. Oh, sorry. Sure. Is that okay? I think I almost want to say something a little bit like, to be an artist, you have to also live in the world and allow yourself time away. Like, to do this work, you have to network and allow yourself to experience and be in your community. I was formerly a dance and movement facilitator for Gibney, which developed a program, a trauma-informed movement program for DV and IPV survivors. And that program is now over 25 years old. And it started because the choreographer and a clinical social worker sat down next to each other at a fundraising event and had a conversation, and decided, oh, what can we do together? And so I think a very practical first step is get involved with your community and see who are the other people who are open to this kind of work.
To piggyback, it was just identifying a need, just something so simple, identifying what the community really needs, and then how you can be a vehicle for that pathway to provide a solution, honestly.
I would say start with something that makes you feel like a total all-star, right? What is that? Is it crochet? Is it collage? Is it playing the ukulele? Is it a chorus, right? And feel that within yourself first. Keep it super simple and have that be your comfort zone. Have that be muscle memory that's baked within your core that you really don't even have to think about. And there's so many different ways to be creative. It can be anything, right? And then find a population that could use it. I think about metaphors a lot. And so I think about the edges of our society, things that get pushed to the edge. And this is what's interesting to me artistically, is trying to find those edgy populations that might not have otherwise had the experience to sit down and cut up magazines and glue them together with you. Right. So maybe you're not as comfortable with this population, but because you have collage as part of your core, you don't have to think about that part as much. It's really simple. The public health benefits are secondary. They happen as a result of this lovely simple thing you're doing.
Piggybacking, thanks, Sarah. Remembering what arts did for you. That is my biggest reflection on, or my biggest drive on how I do art making and creative work. I remember how it saved me, how I went through things, and how it became discipline and hope and joy and connection and meaning and breath, just life in general. So I remember those things, and that's what I tried to bring to the community as well, just a state of remembrance and association. So there's easy connection. So it's not a hard force. Like Sarah said, is what do you do good at? What are you good at? I'm good at dancing. I'm good at moving. I'm good at connecting with people. And so that's kind of how I drive it. So that would be a way to start your initiative is what are you good at? And then what do you like doing? And then do it with other people.
I love it. And invite other sectors to join you, other folks that are in the public health and community development space. All right, let's move on. Okay, so we talked about artists or individuals that want to get into it. What about small organizations or community groups? Do you have any examples of how organizations have like gotten an idea to do something and made it happen? And it could be something that you're part of too.
What I see a lot is people who have a really lovely idea, and there's a lot of effort going into developing this idea in a silo as a new thing when there's all of these other programs that already exist that could really benefit from a boost. So I think partnering with these existing organizations is always a great first step because some of them are, severely under-resourced. So I teach an art class for adults with disabilities out at a place called Grow Hub, which is a great example of that. It's called Grow Hub because first of all, it's a plant nursery, and second of all, it's a hub for the disability community, right? So this is old land that was owned by the school board, kind of decrepit, and we went in as multiple organizations. So the school board, the Grow Hub nonprofit, a place called Working Food that saves seeds, a composting business, the local community college disability center. All of these went in on a 50-acre nursery to provide programming for folks with disabilities in the community. So by pooling these resources, we're also saving our admin time and maximizing our yield. Just for some gardening lingo in there.
Lovely. Okay, I'm gonna move into I think maybe the Q&A. Let's see. We don't have much time left, and I want to make sure we get to some of these questions. But okay, I would like to hear from all of you just this question, and then we'll move into the Q&A. How do you communicate the public health value of the arts to public health folks leaders, policymakers? Anyone?
Through stories. I really admire the work of Paul Farmer, who was the founder of Partners in Health and an anthropologist, and he did ethnographic writing. And the reason I admire him so much is because he has a brilliant way of zooming into stories on an individual level, a mother, right, and what her experience is, and then zooming out to how her story is affected by the public health landscape. I think we learn best through stories, and this is how I talk about my work often.
I would just add that those stories are data, and that's something that we talk a lot about is how do we mix the quantitative and qualitative data. And as Natalie, you were saying, there's so much research out there that the University of Florida has put out. The Jameel Arts and Health Lab has excellent resources. Daisy's new book is an amazing resource, Our Cure. So being able to pull from that, because there is data, and I do think it's important to be able to tie that into the work that we're doing. I mean, I'm on a R1 campus, just like UF. It's sometimes we do have to talk in numbers, even though that might feel a little bit itchy for artists.
I would say sharing an experience, sharing in on an experience. A lot of times it's just engagement. How somebody feels is very impressionable. And outside of a storytelling, that could be that's a great way to portray the information or the experience if they're not going to be in the space, but just putting them in the space where they're getting that firsthand experience of what it's like. The testimonials, qualitative data is an amazing way to get impact and results. And I think just having people there to just see what the work looks like on the on the ground, because they're not able to see that all the time as policy holders or policymakers. And that's really important, just being able to see like, dang, this is what the impact looks like. And seeing those results are life-changing most of the time.
Thank you. All right, let's move to Q&A. We're gonna get through as many as we can, and what we can't get through, I will endeavor to make a document that answers them, and then I will share it with everyone who's registered. Okay, so from Craig, do you see many examples of arts and health programs being integrated into social prescribing programs? And the answer is emphatically yes, but I'll let others take it.
Yes, I would. I almost want to hear from Sarah and Shira, because I know UF Shands has a great program. But yes, we were incorporating our arts and health work. So
yes, Dance for Life is a social prescribing program. So the language looks different. I think a lot of times people kind of overzealously approach the language as though it's needing to be labeled as this or this or this or this. You're probably already doing the work. You just don't have a name or language to put towards it. But yes, in short, Dance for Life is an arts prescribing, social prescribing program. We work with this Fixed Cell Institute. It's a neurological based center that refers their patients to us so they can minimize fatigue or build community, work on social isolation, or eliminating social isolation. It's more that reduction of the things is what we do in our program. So they report back. We also do surveys. Their physician will also come into our class and participate in our class. So he'll see the results firsthand. And he'll also be able to see, hey, I'm evaluating that these things are happening. There's a lot of cultural exposure that is happening. There's a lot of intergenerational work that's being done. How can I put this in a survey so you guys don't have to do the work? We can get the survey that's going to sift this information, and then we'll be able to kind of evaluate the program from this way and this way as well. So social prescribing is definitely a thing, whether you have the language around the programs that you're doing or not. We're just making connections with clinicians, and we're doing the work as artists and going from there.
I answered in the chat too. The Center for Arts and Medicine and partners, Tasha Golden and Ali Mayer, a big group of thinkers put together Arts on Prescription, a field guide for communities. And it's essentially a roadmap for building social prescribing in your community with lots of examples of models. There are lots of different models out there. We also have a case study report that was, Farrell, if you're there and behind the tapestry, if you could drop these links in the chat, that would be useful. On the Epi Arts Lab website, there is a case studies report that examined 23 different social prescribing program models. And it's a great comprehensive look at what social prescribing can look like. This one is there. Okay. Any other thoughts before I move on? Let's see. Okay, how about we're getting some about like program development. Like how do you design programs? Do you use like what kinds of what strategy do you use to design programs? What's best practices? It looks like Tessa is typing an answer to that one.
I can piggyback off that a little bit.
Sure.
So I originally, Seniors on the Move was a pilot program, and I wanted to make it where it was sustainable and it was a program that was going to be ongoing. We ended up doing it we adopted it as a program with Arts and Medicine outside of me having to do the program. But what I originally did was I presented a proposal for how we can create longevity and permanence within the program. So created a scope that gave the overall view of what I was trying to get accomplished, identifying the description of the program, like this is a BIPOC community that is underserved that would like to do X, Y, and Z. And this is the results that can yield from it. I did programming. I also did some research-based models so we could implement like a research, which was a little bit too comprehensive, but research that could be implemented to create funding opportunities in the future if we had issues with sustainability. I created possible resources, so leveraging partnerships, who in the community I could partner with, just to leverage some of the resources that we didn't have within the house of like practitioners, and also just to leverage more bodies. As art practitioners, we do a lot. And sometimes resourcing and sourcing out with others was a way to create sustainability and also help develop other people's programs as well. So we're just not being that anchor with the University of Florida, but we're also helping to bring and bridge other programs along. But creating resources, community-based resources, and then an evaluation process, just starting just from that infrastructure, finding the need, describing the program you'll do, creating resources and evaluations, and then doing the work.
Mm-hmm. Yeah, very good. All right, I think maybe one more question, maybe two. From Cynthia, how can we engage more people to help with some of the lifting? Speaking to what has been shared a little bit, but maybe we can have some concrete examples. She's saying that there are turf battles that emerge, and again, like people are coming with different value sets and these different and different kinds of pressures. So how might you think about, again, I think it goes back to the cross-sector collaboration, if there are any concrete examples of how the load can be shared, I suppose.
I'll just say as a strategic tactic that I use is that I just lift up partners whenever possible, right? And this does many things, right? It gives them a greater sense of autonomy with their leadership within the project. It makes them feel like they're owning it with you. It looks good for their organization. They can share it out as work that they are doing, and it puts more boots on the ground instead of you having to do all of these things. I mean, really, I'm just a hype girl that's dressed up like an artist. But, you know, hyping these arts leaders, hyping these other organizations, and giving them credit for the hard work of collaborating is a big part of it.
All right. Oh, you got something, Shara?
I'll echo the same thing Sarah said. Honestly, just platforming other people's voices so there's a level of importance and shared partnership is yeah is how I do it too. But so I don't have to do all the work because it can be fatiguing, it can be exhausting. But those partnerships are very pivotal to sustainability.
Yeah.
But yeah, that's it.
And I think to add, you know, you find your champion or champions within those other organizations, and then like communication, like with any human interaction, communication very early about the differences in your values and the differences in the cultures that you're coming from and where you might find compromise. Like those really early conversations, being real about what will be difficult, because as has already been mentioned in the chat and in the Q&A, like people in the public health space understand that it's hard. I mean, I think artists and public health folks right now are we're all struggling in a similar way in this country, but health is important to most people. And so this is a place where, you know, public health folks and artists and culture bearers can use their expertise and present something that is different, where and coming together different in a way that, you know, the artist is able to relay a message that resonates more, that might not come from a public health, like as trusted from a public health source alone. But those early conversations about what the real challenges will be to the people you report to, the funding issues. But I will say that because of this collaboration, it could open more funding opportunities from the artist side into the public health sector, and from the public health side into the arts and culture sector. So that's something to consider when you're looking for grants and thinking about partnerships around those grants. All right, what time is it? We got 5
Can I add
minutes.
one tiny
Yes,
little thing to that,
please.
Natalie? I would just say, I think funding is such an important conversation, especially in the arts. It's never going away. But also resource sharing, like what are the resources that you can share that are beyond funding, and being really open to that. We talked about this a little bit. Are there people who you're working with who can provide the evaluation expertise? And what are the things that you bring as an artist that are unique? What are the things that they can bring? So I do think that while funding is one avenue for that, there are also so many other in-kind resources or skill sharing that is also available.
And then quickly, you know, we talked about like the administrative lift before these community engaged projects. And I also think it's important to mention that you keep lifting once the projects are completed. I mean, maybe they're sustainable and they're ongoing forever, but if they're seasonal in nature, that you continue participating with your communities and talking about what worked and what didn't, right?
Lovely. Okay. Okay. Maybe as a closing question, what do you see as the strongest growth area for arts and public health over the next 5 years? This is for the panel.
True diversity and intention with artists as well as programming. I'm a minority, of course, double minority, and I think it's always important to give the things that seem optional to some as a necessity and a tool for others. So being very intentional with giving these tools and sharing access in spaces that it's not shared. And having representation, like if you're going to have a program that's with the BIPOC community, there should be some representation as artists that are people of color, and then so forth and so on. If you have a program that is focused on language barriers or something like that, someone who has a language barrier of some sort. I used to be an interpreter, so working with the deaf and hard of hearing community, have the resources for them to be able to access it on a permanent basis or something. Give them, leverage the resources that you have as an institution, so there is some sustainability outside of yourself. And I think those are really important. Giving people access for real, like sharing the power for real, is really important. So it's equitable for all, because we all want to be well, we all want to be good, we all want to be renewed, we all want to live forever, or at least for a while. And so giving people what they need to live and to thrive and have a great quality of life. So sharing those resources are very important, and having that representation as artists and in the population of whatever community you're serving, I feel is very important.
Our former Surgeon General Vivek Murthy addressed social isolation and loneliness as a public health epidemic that's facing our country. I'm sure that many of the folks on this chat know about that already. And I feel the weight of despair in the world sometimes. And I know that our next gen feels it pretty heavily. And I think that the arts are uniquely equipped to address this despair and keep us resilient.
I'm also going to drop in the chat because he is now on the WHO Commission on Social Connection, which I love the flip in that language that's happening too, of kind of moving away from isolation, even though it is, of course, two sides of the same coin. I really want to see artists at the table. I want to see them in policy settings. I want to see them in, not just, oh, we should bring in an artist because they're going to make a cool, flashy thing before we do this big conference. Why aren't artists there as a part of the organization? Because they bring so much creativity and problem solving and skills. So I just want to see artists in the room from the beginning. That's what I hope.
Yes, I'm so glad you mentioned policy, because I think that for me, that's the growth area. That is, people didn't wear seatbelts until there was a law about it. I think when we enact legislation that infuses the arts in as an essential partner for public health, that's when we will see big movement. And I'm happy to report that Georgia is the first state in the country that has done, Atlanta and Georgia have done just that. They have recently passed Georgia House Bill 1, it's HR 1007, and it uses the arts to support mental health and mental health outcomes in the state. That's huge. And so that can be a model for other states. And that's a conservative state, by the way. That can be a model, and down the road, 5 years from now, hopefully we move into a national space with that. I think there's real potential. That to me is the next frontier. Okay, it is officially 3 o'clock. How did that happen? It goes by so fast. Okay, everything's been recorded and will be sent. All of the things shared in the chat, I will share the chat so that you can get people's contact information. I will also share all the resources that have been mentioned. There are lots of questions about how, like, evaluation and research methods. The next webinar will be evaluation and research in this space. So sign up for the next one. Even if you can't attend, you'll get the recording. And other folks asked, I saw around building a program, support with building a program. We do have the Arts and Health Intensive that we conduct every year. And as soon as those details get nailed down, we will send them out through our newsletter and social media. So keep an eye out for that. And We also share tons of resources and opportunities, arts and health specific, in our newsletter. So if you aren't already signed up, that's a really good way to keep a pulse on this work. Thank you so much for coming. Big round of applause for the panelists. And another big round of applause for the attendees. The level of encouragement and resource sharing, that it's shared wisdom, collective knowledge. Thank you so much for coming. We can't wait to see you for the next one. And have a lovely afternoon. Keep it kind. Keep it classy.